County Durham and Darlington NHS Foundation Trust is committed to the health and well-being of its own staff members. Both the Keogh report and the Francis inquiry identified that better staff health and well-being is associated with improved patient outcomes.
Our staff are at the centre of delivering high quality patient care, and in order to do that we have to ensure that they are in the strongest position to be able to do that. So we want to promote good health, good well-being. We want to provide an environment in which it is safe and healthy for them to work, and we embrace all opportunities to try and do that insofar as we possibly can. And there's an awful lot of work available to demonstrate the links between a healthy workforce and good patient care.
The Trust Occupational Health team run a series of events throughout the calendar year.
Well done, lovely.
As well as local initiatives around national events like No Smoking Day, they encourage various activity groups, including running, cycling, yoga, Pilates, and advice on healthy eating. They also stage roadshows to inform staff about their work and what's on offer across the Trust. The annual flu jab campaign is one of the most important schemes they operate.
This flu jab is really important to protect yourself, your friends, your family, your colleagues. You could be a carrier of flu and you could take that home to vulnerable people. And we just want people to sort of, have the flu jab so they're not ill, because if you do get the flu, it can be fatal. It's not just a bad cold, it can lie you up for weeks, and actually, like you say, you can actually die if you do get the flu. So we want to encourage all our staff to have the flu jab. There's some mythbusters on the intranet, so people who are a bit worried about things, they can have a look at that. But we want to encourage all of our staff to take up the offer of the free jab.
The Roadshow event aims to showcase services available to staff to aid health and well-being, both in body and in mind. Staff morale, sickness days, stress-related illness, and musculoskeletal issues have all been identified as areas where improvements can be made. The Trust is also encouraging members of staff to become health advocates.
A health advocate is somebody, I think, who encourages staff to keep themselves fit, healthy, and to encourage other members of staff to keep themselves fit so they can stay at work, and obviously get that support from the colleagues. I think if you keep your workforce fit, healthy and happy, it means it's a better benefit for the patients. Obviously, your workforce are the people who look after the patients at the end of the day.
The health and wellbeing message has also been sampled by the Trust's senior management, who were treated to a yoga session as part of a recent team meeting. The Trust is encouraging each member of staff, as well as potential future employees, to take steps to improve their own health and wellbeing wherever possible.
I would anticipate that as a member or potential member of staff of a healthcare environment, that you would want to do that for yourself, that it is a priority, that you understand the implications, and that we as a Trust would want to work with you in every way we possibly can to help you achieve that. And it is in everybody's interest to do so. I mean, we reduce sickness absence, which means that we have more staff at work. We have more staff at work, which means everybody becomes more engaged, and therefore it's a more positive and enjoyable environment to work, and immediately then deliver much better patient care and service. So come and join us and bring all your good ideas, and we'll work with you to see if we can deliver that.